Hello, my name is Claudia Moreda, and today I will be presenting my case report titled Iron Deficiency Anemia Presenting with Generalized Edema in a 16-month-old male. It is well known that excessive ingestion of cow's milk has been associated with IDA in children, mostly due to low concentrations and low bioavailability of iron in cow's milk and occult intestinal blood losses. Protein-losing enteropathy in the setting of severe IDA and excessive cow's milk intake is an unusual phenomenon and can be challenged to recognize. PLE is characterized by protein loss through the GI tract, causing hypoproteinemia, and this might be complicated by edema, ascites, and pleural effusion. This is caused mostly due to protein leakage through the gut or diminished uptake by the lymphatics. The cause of PLE in this setting is most likely due to multiple overlapping mechanisms, like increased mucosal permeability and damage directly to the intestinal epithelia. This is the case of a 16-month-old male that presented to the Pediatric emergency department due to generalized edema that started 2 weeks prior to the evaluation. During his first day of illness, the patient's mother reported that she initially noticed a protruded belly button and abdominal distension, reason for which she visited his primary pediatrician, who recommended close observation. During his 14th day of illness, the abdominal distension persisted, and now she noticed marked swelling around both eyes, reason why the patient was brought to our ED. During the review of system, he had decreased urinary output, and physical exam was remarkable for bilateral periorbital edema, abdominal wall edema, and lower extremity pitting edema. His diet was remarkable for a PO intake of more than 50 ounces of cow's milk per day. On laboratories, his CBC was remarkable for microcytic hyperchromic anemia, low iron levels, increased RDW, and a Mexer index of 21. He had hypoalbuminemia, low total protein, and he had an elevated fecal alpha-1 antitrypsin and no proteinuria. He was treated with iron supplementation, and mother was instructed to limit his cow's milk intake. On follow-up 2 weeks after discharge, patient hemoglobin was on 13, albumin was on 4.9, and physical exam was unremarkable. Most of the published cases of infants presenting with severe IDA and PLE are dated before the widespread practice of iron fortification of cereals and formula, around 1950 and 1960s. COVID-19 pandemic has changed dietary habits of many families, particularly in low-income households, exposing children to food insecurities, compromising dietary diversity, and increasing the risk of malnutrition. Practitioners should suspect PLE when a patient presents with generalized edema and IDA in the setting of excessive cow's milk intake. Thank you very much for your attention. Hope you enjoyed.
Created using Powtoon.